So again, good afternoon and goes almost good evening to everyone. For this semester, as what I have mentioned, we have our course of pathophysiology. Actually, not all schools, not all nursing schools have the course of pathophysiology because as your dean, I have included pathophysiology as one of your courses simply because this will be necessary for you to have the necessary knowledge and skills that will be very important when it comes to clinical decision making. Evidence-based practice as our reference when it comes to the provision of standards to the care management of our clients. Even in the pharmacology, I have oriented you on how the drugs took place and have its effect to the body. You have been oriented on how these drugs will give therapeutic effects to the patient. And questions arise even before, during our pharmacology, that why is it necessary to consider drugs or pharmacological management as a way of treatment for a specific diagnosis of clients. Because eventually, we have concluded and even reiterated during that time that pharmacological management is part of the treatment regimen if the body cannot anymore tolerate the condition of, of managing the problem with dysfunction, deviation, and disequilibrium. So that's why if the body is not responding to its normal functioning and definitely not compensating to prevent complications, the pharmacological management or drugs are necessary. Then the pathophysiology is very important. I know for a fact that you have done your case presentations. Case presentations are very important. Embrace these activities as well, because you will really learn on how to apply analytical and critical thinking. In pathophysiology, this may vary. This may vary from certain conditions. Although, if you will look for references and look for a specific case, if you will just type in the search engine, pathophysiology of diabetes, there are common pathway of how diabetes develop from the certain types of factors, risk factors. So you will be oriented in pathophysiology. What are those risk factors? And what is the relationship of risk factors in the development of diabetes? Another that I will connect from what you have learned in the previous semesters and in your even in your previous subjects that you have completed in the past semesters, health assessment and fundamentals of nursing. These are the foundation concepts wherein you will learn normal, normal and expected assessment for an individual who do not have any deviations at all. What is the importance of knowing the normal assessment? Because it will give us the idea if your assessment deviated from normal. That's why whenever you will analyze the condition of, for example, why is it necessary to do assessment and identify signs and symptoms? Signs and symptoms are very important as our reference to give us a direction of what would be the appropriate care plan or intervention to the client. That's why even in the first column of your nursing care plan, we indicated there the subjective and the objective, because the subjective can be validated through the objective, which means that this could be confirmed with the findings of the nurse's assessment or physical examination, vital signs, results of diagnostic exams, as this will give you the direction of the right and appropriate interventions. And what is the essence of having pathophysiology for nurses? Sir, before pathophysiology are only intended for doctors because they're the ones who are more knowledgeable when it comes to the diagnosis of the client. In this situation, nurses must be and is who are nurses are part of the healthcare team. We will have equal responsibilities as same as the doctor. Because once you will be assigned into specific areas, just like emergency room, and when you attend to the client, what comes to your mind is you will check vital signs. And vital signs is very necessary for you to prioritize conditions of your client, to prioritize eventually the prevention of complications. So what is the essence and what's the connection of the pathophysiology? You have been oriented on how to do patient history. When it comes to the patient history, you ask the patient one question. Ano pong nangyari sa inyo? Then the client will elaborate what happened. Kailan po nangyari? Paano po ang nangyari? Ano po ang naramdaman ninyo? Those are the questions that will guide you on identifying the risk factors on why the client is experiencing those manifestations. So, with that knowledge, you will apply your skills to continue the assessment and gear towards what appropriate diagnostic examination is necessary for the client. Let's put it this way. Let's have an example. For example, the client is experiencing severe difficulty of breathing. I know for a fact that you will answer me for every now at this time. For a client who is experiencing severe difficulty of breathing, COVID yan. I will just ask the body. I will ask everyone. Do all difficulty of breathing, or for those clients who are experiencing difficulty of breathing, can we conclude solely that's it's only COVID-19? So I want to have response of the group. So anyone can share. Will you agree with that concept that severe difficulty of breathing can be only now associated with COVID-19?
No po.
No po.
Okay, so I think Miss Arbo responded. Can you elaborate it more? Why? Can you elaborate it more?
Siguro po din, since COVID po yung masyadong talamak na sakit ngayon, and since sa lungs nga rin po, so yung mga tao na may misinterpret po talaga nila, o siguro masyado lang po sila natatakot na kapag kunyari nagkaubo ka or nagkasipon ka is COVID na. Kaya po siguro kapag once nalaman nilang may ganun ka, isip nila may COVID pa po. Siguro masyado lang din po silang takot. And then may mga sakit din naman po kasi na like asthma, na it doesn't mean po na may COVID ka.
Correct.
So, yun lang po.
Ayun. So probably we will just have some of the analysis of your response. You have mentioned that the present situation basically affect yung signs itself, or yung symptom itself is always associated with COVID-19. However, you have mentioned that not all individuals can definitely can be associated with COVID-19, because you have mentioned that they have history of asthma. So there could be two ways. It could be at present, because since it's pandemic, okay, we could have COVID-19 as one. But we must also ask, this may reveal if you will have your patient history and you will ask the client, do you have any history of asthma? Then what will make a difference if you are suspecting asthma over COVID-19? Kasi difficulty of breathing pareho. So probably what could be your basis to validate the difference na that severe difficulty of breathing is not associated with COVID-19, but rather it's definitely asthma? What could be your guide? What could be your what will boost your confidence na it's not COVID-19? Probably it's asthma. Possibly it's asthma. What will give you more confidence for confirmation?
Patient history.
Okay, one is patient history, because you will associate it with the history and with the onset or the start of the manifestation or the symptoms. Any other that yeah, come again?
Ano po, yung mga test po, like swab test, RT-PCR.
Okay. Who's answering?
Aling din po.
Who's answering po? Who's responding so for you to be acknowledged?
Alimbuyugin po din.
Yeah, Miss Alumbiyugin. What have you said?
Ano po, yung test po like RT-PCR test, swab test po. Parang confirmatory test po para po,
Correct.
ano po.
Exactly. Exactly. Now you are leading into that direction that what we are digging out of this example. You have mentioned that for you to have a confidence and have the appropriate direction when it comes to therapeutic management is to have a confirmatory test. If, for example, the client is not positive for the RT-PCR test, so by patient history, the client is having asthma. So you will be out of the picture to manage the client with COVID-19, and eventually you will now focus on the chances that the client is having asthma. Because mainly, if we will try to weigh the problem with severe difficulty of breathing, these are the conditions that are very critical and possibly may lead to death. Sooner or later may definitely lead to death. So one challenge definitely for a nurse is how I will attend definitely to the client who may need immediate medical attention, and at the same time, I am in the right direction of my care management. So that confirmatory test will give you confidence that your care management and intervention is appropriate for the condition. Thank you very much. That's correct. So another for example, another situation other than difficulty of breathing, very basic nowadays, fever. Okay, sometimes because again of our orientation in news, in social media, you have been oriented. I know everyone already mastered the signs and symptoms of COVID-19, but somehow, di ba, in most of the establishments, ayan in most of the establishment, di ba, meron tayong temperature check, temperature scanning. And if it goes that it caused the alarming of the temperature because it is more than, for example, it is 38 degrees Celsius, how you will face it? How you will face it? That you are so sure, that it's not COVID-19. Anyone can share?
Maganda po siguro kung hindi yun yung swab test po, sir. Kasi po yung lagnat kasi reaction ng katawan yan kung sakaling mayroong problema sa atin. And hindi lang pwedeng COVID po. So maganda po yun yung swab test po para malaman po natin. Pwede po ma-infection si yung pasyente po, ganun po.
Okay. So ibig sabihin you will for example, it caused a fever, and ikaw yun put the situation to yourself nag-scan, nag-38. So aware ka that you will have the swab test. So confirmatory, that's one. Another is, will you suggest to check the temperature after 15 minutes? Will you suggest that? Because eventually the environment, pwede ba contributing factors yung environment? It's for
Yes
example,
po.
yung too much heat. Kasi di ba convection, scientifically explained, convection can change the temperature of the body. So is it possible na yung 38 mo, it's because of too much heat that has been produced because of the environmental factors? Di ba pwede rin yon? So probably you will be checked. You can suggest that you will be checked after 15 minutes. Hindi yung, okay, nag-alarm agad yung parang hindi pala. Parang fire alarm pala yung nadinig natin. Hindi. For example, nag-alarm yung temperature scanner and it goes with the findings of 38. Siyempre, you may suggest, sir, can I be isolated first and be checked after 15 minutes so that to check if I have improved, because I've been outside for almost 3 hours, and this could be possibly kasi pwedeng metabolic response of the body. It's a normal response of the body. Pero when it comes to the situation now, alam mo naman, most of the people may misinterpret it. Okay, COVID-19 associated already with COVID-19. Pero tayo naman as future professionals, we could manage it eventually na check it first because normal response of the body, or possibly the fever is basically from the other perspective, it's not COVID-19. So I think Miss Abante, you will want to share something? Miss Kyle?
Ano po din. Yung
Yes.
sa akin po sana tawag dito, kaparehas lang din po sana nun sa inyo, tawag dito sa environment kasi nga po pwede niyang increase din yung temperature. Tapos po, dagdag lang din po siguro, pwede po natin tanungin yung client po dun sa last activity niya. At the
Yeah.
same time po, tanungin po siya kung ano yung mga in-intake niya kasi pwede pong mag-cause ng increase in temperature yung mga medications na na-take niya. Tapos po, for example po, nagpabakuna pala siya, minsan po side effects po talaga sa ibang tao na lalagnatin po kasi foreign body po yung in-insert sa katawan natin. Lang po.
Yeah. Those are those are valid responses kasi you have mentioned about environmental factors. Second, if the person had been vaccinated just for example 30 minutes or 1 hour ago, kasi 'di ba you have the needle itself hit the tissue. So there's a tissue damage. Anong response doon? Inflammatory or inflammation. Eh 'di ba ang inflammation, as what I've told you even before, nagre-release yan ng mga biochemical mediators na pwedeng mag-synthesize ng prostaglandin at mag-increase ng temperature. And with that, it is associated because of the vaccination, not because the patient has COVID-19, right? So correct. Can we associate a rise in temperature sa pagkain? Kasi kung for example, I have eaten too much spicy foods, tapos yung body natin, 'di ba? Yung nag-i-increase yung metabolic response at nararamdaman niyo 'yon if you eat too much spicy foods. Lalo na 'yan, mahilig kayo sa mga Korean, 'di ba? Yung mga spicy foods. Um, nararamdaman nyo yung heat na napoproduce ng body out of those food, and possibly if you will check the temperature, it will increase. Kaya tayo, if leading to that perspective, you will ask definitely questions that could be related to the patient's history. You have mentioned about physical activities. If for example, di ba, if for example, galing ka sa gym, you've been in the gym, you have been engaged into physical activities, di ba sympathetic response yun, increase ang metabolic response ng body. So syempre mag-produce yun ng heat. So pag nag-produce yung heat ng body, ng heat ng body mo, hindi naman agad-agad yan bumababa until your body response is immediate. Pero kung talagang immediately coming from the perspective na galing kasi sa gym at yung metabolic response mo pa rin ay increase, there is a possibility na yung production of heat is also possible. So those reasons are correct. We are leading on an analysis that is very significant for pathophysiology. So that's why this is very important. This will give you an idea on how you will use your analytical thinking in certain situations. Kasi sabi, as what you have mentioned, not all individuals who may have fever can be only associated with COVID-19. Not only with severe difficulty of breathing can be associated with COVID-19. Although with those orientation, it could be preventive. But we must take into consideration that there must be a confirmatory test to facilitate specific management, right? So yun. So I think we are getting to our discussion and hoping I may hear other students who may participate in our discussion. We are now 41. So probably the 40 students are in the loop of the Zoom, and I'm hearing only 3, 4, 5. So I want to hear 35 students to respond also to my questions, because I know it's my accountability to check your level of consciousness. Somehow baka others na ay not speaking, and I know in the level of consciousness I need to check motor response, I need to check the eye opening, I need to check the verbal response. So one of the ways that I can assess if you are still interested and if you are still having active participation is verbal response. Okay, so next we have the description of pathophysiology. From the term itself, patho, it's always associated with disease process. Okay, it's always the cause leads to the disease process. And if we talk about physiology, I know for a fact during your first year, you have already your anatomy and physiology. So if we talk about the physiology and if we talk about the anatomy, what's the difference? Why it is combined with each other? anatomy is basically on the perspective or on the aspect of the structure of the body. And if we talk about the physiology, we will focus more on the function. Okay? So let's have an example or somehow an assessment on how we could identify the aspect of physiology. Kasi if we talk about physiology, it talks about the processes, the function of a specific organ or the specific system. Okay. If we talk about circulatory system, what could be your response for anatomy? Circulatory system. What could be your response if I will ask you what is the anatomy of circulatory system? What is the anatomy? Or my second question or my follow-up question is, what are the functions of circulatory system? Those two are different perspective, different areas. So if we talk about physiology, we're talking about the functions, and if we talk about the anatomy, we're talking about the structures that compose the system. So can you answer? I want to hear from the others po. Circulatory system, anatomy. When Mr. Buen Consejo.
Opo. Para po dun sa anatomy po ng circulatory system, we have po yung blood vessels and the
Correct.
heart.
Correct.
Tapos po yung physiology niya po niya ay nakikerry po siya ng oxygenated blood po in
Okay.
the heart, and
Okay.
pinupush po niya yung oxygenated blood naman po outside of the heart po.
Okay. So that mainly answers. Thank you very much, Mr. Harold. If we're talking about anatomy, since we're talking about the structure, what are the organs? Yon. What are the organs that are identified in the circulatory system? So we have mentioned the heart, and we have mentioned about the blood vessels. So what are the functions? So sa functions, we're talking about, from the term itself, circulatory, circulation. And if we talk about circulation, this is related to the blood. And if it is related to the blood, it is related on how the circulatory system function. Distribution, di ba? Distribution of blood to the different systems, organs, and tissues of the body. So another function is ejection of blood. Yan, ejection of blood to convert unoxygenated to oxygenated blood. So those are the processes. Okay, those are the processes. Now, let us now connect with your basic understanding of anatomy and physiology when it comes to pathophysiology. Okay, di ba? If we talk about the physiology, you are aware of the normal functioning. If we talk about the patho, there's already a specific disease that may affect the processes and function of the circulatory system. One example, the heart is having inflammation of the tricuspid valve. Go back to your foundation. The tricuspid valve is present at the right side or at the left side of the heart. I want to hear answers. Tricuspid valve is present by anatomy. By anatomy. Right side or left side of the heart?
Right po, sir.
Okay, correct. Mr. Go. I think Mr. Gong is the one who answered. Okay, thank you. Right side of the heart. Tricuspid valve is anatomy. Let's go now to physiology. What is the function of the tricuspid valve?
Prevent backflow.
Correct. Who answered that?
De Leon po.
Okay, thank you, Nathan. Mr. De Leon. To prevent backflow. Now, let us connect. You are now aware of anatomy and physiology. The structure is present in the heart. Tricuspid valve, specifically on the right side of the heart. The function is to prevent the backflow. Di ba yan yung valve? Okay? To prevent backflow. Once the blood enters from atria to ventricle, it will close so that it prevent backflow. Okay. Now, this is now the problem. We will now connect in pathophysiology. There is inflammation of the tricuspid valve. if there's inflammation of the tricuspid valve, there could be a possibility that it may limit the opening of the valve. Okay, it may limit the opening of the valve. So that's now the problem. That's now the problem, inflammation of the tricuspid valve. Now, what is now the pathological consideration? What is the patho there? The inflammation of the tricuspid valve. By anatomy, you're aware that the tricuspid valve is present at the right side of the heart. Now, physiology. Can you give me a possible physiology that may happen because of the inflammation of the tricuspid valve? We have now discussed, di ba, na to prevent backflow. Okay? So if that will be your orientation, oh sir, probably if the tricuspid valve's function and physiology is to prevent backflow, so if it is inflamed, it will cause backflow. Di ba? We have the idea na posibleng magkaroon ng backflow because merong dysfunction yung tricuspid valve. Okay. If it will cause the backflow of the blood and will not proceed unidirectionally, what may happen next if it will cause backflow? Meaning it does not proceed to ventricles, but it causes backflow. You may raise your
Pump
hand so that
harder
you
yung
will be
heart.
acknowledged. You may raise your hand so that you will be acknowledged. Ayan. So I think Mr. Harold. Okay, Mr. Harold.
It could compromise the cardiac health that could lead to the decrease in oxygen saturation. It could even further make the heart pump harder po.
Okay. Your response, Harold, is general. When it comes to before it will compromise the general cardiac function, let us specify what will happen first on the right side of the heart. Because the event and the problem is happening on the right side of the heart because of the problem with tricuspid valve. We have mentioned kanina that the normal function of the tricuspid valve is to prevent backflow. Now you are given the idea that on the right side of the heart, there's a possibility to have backflow. Another analysis. Let's have another analysis. The blood that enters the right side of the heart is oxygenated or oxygenated or non-oxygenated?
Non-oxygenated.
Non-oxygenated.
Okay, unoxygenated. Sige, yan na. We have those kasi it's part of the process eh. Kasi 'di ba the flow of blood on the right side of the heart. If it will cause backflow and will not proceed to the ventricle, do you think the volume of the blood will increase on the right side of the heart? Because it will not be ejected towards the ventricle and towards the pulmonary. Do you think there could be a possibility that it will cause increase in volume of blood sa right side?
Yes po.
Yes po.
Yes, sir.
Okay. So if it will increase the volume of the blood sa right side of the heart, what could be the next? What the next that you are seeing and having a picture of, try to imagine nag-i-increase yung volume of the heart, volume of the blood sa right side of the heart. What could be the next event that may possibly happen if it continues to increasing the volume?
Increase cardiac output.
Okay, but we may not first proceed to the cardiac output kasi the cardiac output happens at the left side of the heart, di ba? Nasa left side of the heart yon. So wala pa tayo sa left side of the heart. We are still on the right side. Yes, Miss Micaela.
Ano po, yung blood po hindi yung volume po, yung blood po hindi po makakapunta sa other side of the heart kasi nga po yung mas nandun na, hindi po siya nakaka-enter na, di na po siya nakaka-enter dun sa valve nga po dahil nga po dun nga po sa inflammation niya which nag-cause
Okay.
dun sa regurgitation.
Regurgitation. Okay.
Opo.
Kung nagre-regurgitate siya, is it possibly na mag-increase ang volume of blood sa right side of the heart?
Yes po. Hindi kasi siya
Yeah. If it will increase the volume in the right side of the heart, what comes next? Okay. Thank you, Miss Alimbuyugin. I will call others po. Probably Miss Castro.
Ano po, ang mangyayari po is try po ng heart na mag-pump harder para po hindi maipot yung dugo sa right side. And if nagtuloy-tuloy po to na hindi nare-repair or walang nagagawang paraan para hindi para maiwasan yung pag-pump ng ganun ka-hard is pwede pong magkaroon ng heart enlargement.
Okay. Ayan. Pero isipin muna natin ha. Before siya, iisipin nyo muna yung flow. Pagka hindi na-eject yung blood, nag-i-increase yung blood volume, enlargement ba agad? Siyempre, di ba, it may lead muna sa congestion. Di ba? Magko-congest yun. Di ba? Yung right side of the heart. Pag nag-congest yung right side of the heart, what happens next? Di ba magi-stretch yung magi-stretch yung ma-overstretch yung muscle? Pag na-overstretch yung muscle at mag-congest, what happens? Magko-cause ng increase in the size of the heart. If it will cause increase in the size of the heart, it will cause the possibility that it may lead to enlargement of the heart or cardiomegaly. Now, we have analyzed that the inflammation of the valve possibly may lead to the enlargement of the heart. Nakita niyo yung, have you analyzed the flow? Through that processes that you are aware as a foundation in the anatomy and physiology, it will give you the idea on the situation na, oops, hindi pa nagtatapos diyan. Kasi for example, no, I'll give you another sige, ituloy natin yung discussion. I'm having my excitement in the discussion because you're having good responses. If it causes enlargement of the heart, and you have mentioned that it will cause backflow, will it be possible that the blood in the right side of the heart will regurgitate and will have backflow to where it came from? Will that be possible?
Yes po.
Yes. So, next, where from the right side of the heart will lead its backflow? What structure will lead its backflow? So, isipin nyo na naman, before entering the right side of the heart, yung blood, saan siya nanggaling? Where it came from? So, saan siya nanggaling?
Right atrium.
Right atrium po.
Yeah, from the right atrium, saan pa siya
Superior vena
nanggaling?
cava.
Saan?
Superior vena cava.
Okay. Superior vena cava is a blood vessel, right?
Yes po.
Okay. From the superior vena cava, is it possible, the superior vena cava is already a blood vessel, right? So, is it possible to go back to the blood vessels? Is it possible to go back to the blood vessels?
Sir, lalaki lang po yung na yun. Yung vein po na yun.
Yes. So, di ba yung saan naman tayo magkakaroon ng problema? Magko-congest, it will cause congestion naman doon sa blood vessels, right? So, is it possible na yung blood na supposedly going to the right side of the heart will cause the delay? Can you imagine yung container na puno na siya and it will not be refilled anymore? So, mangyayari doon, mag-spill. It so happened that the heart right atria is connected to the vena cava and to the blood vessels. So, the next thing naman is mag-i-increase naman yung volume sa blood vessels, right? Kung mag-i-increase naman yung volume sa blood vessels, doon ba magkukos naman ng pressure sa blood vessels?
Yes po.
Yes po.
Yes po.
Okay. So, if it goes back to the blood vessels, yung congestion, will it be possible naman yung mga blood vessels naman sa peripheral or sa periphery ang magka-problema? Pwedeng yun naman ang makongest? So, that could be possible. Now, if it goes back to the blood vessels na nakadistribute sa body natin yung mga vein, will it be possible na yung too much congestion sa blood ay pumunta at mag-congest sa mga ibang blood vessels of the body? The answer is yes. Now, if kung halimbawa nag-congest na yung punong-puno na or congested na, increase na yung intravenous pressure. Kung increase na yung intravenous pressure, is it possible na the fluid from the blood vessel goes out sa spaces? Pwede bang lumabas
Pa yung
yun?
nangingitim po, Doc. Ay, sir. Dito po ba yung nangingitim na? Yung medyo...
Hindi pa siya. Kasi if for example from the blood vessels, the plasma from the blood goes out of the blood vessels at magpo-proceed yan sa spaces. Kaya posible yan magpunta yan sa spaces ng tissues and skin, or probably on the tissues, at dun siya nagko-cause ng possible edema. Di ba? Kasi dumilipat na siya from the blood vessel, lumabas na siya sa blood vessel, napunta siya na sa interstitial space. At if you will notice, na if for example, if the person is in standing position, saan pupunta yung mga nag-shift na fluid from the intravascular to interstitial? Di ba pupunta siya sa lower portion ng body? Saan, anong lower portion of the body kasi siya pupunta?
Opo.
Where, Mr. Paulo?
Sa paa po.
Sa paa, very good. So that's why the possibility that if it will cause edema of the foot or pedal edema, you may suspect that the problem is already checking the heart condition. Kaya that's why pagka meron na siyang, di ba iba ang tinatawag nating pitting edema at saka non-pitting. Yung non-pitting, maga, the pitting edema is manas. And yung manas is, the edema is caused by accumulation of fluid. So kung may pitting edema yung patient natin, you will suspect to check the heart condition. At once you will consider that, the patient must be subject for chest x-ray. Bakit kaya chest x-ray? Can you answer? Any response? Why kaya chest x-ray? Because sa chest x-ray, makikita ba natin yung view ng normal size of the heart? Pwede ba
Yes
yan na
po.
may measure yung normal size of the heart? The
Yes
answer
po.
is correct. So on that perspective, ayun, justified, confirmed in the x-ray, the patient is having cardiomegaly. Saan siya nag-start? Nag-start siya because of the inflammation of the what? Inflammation of the tricuspid valve. And from those events na pathophysiological events, you can now explain confidently why the patient is having pedal edema or foot edema. Kaya for a nurse to say na, ma'am, I'll check. Oh, it's pedal edema. Let us check the condition of your heart. O, edi ikaw naman, as nurse, wala ka pang x-ray ha, you will check the vital signs. So specifically, you will check blood pressure, those that will definitely affect the condition of the heart. Blood pressure, you will check the cardiac rate. So, the next thing to do is subject the client to the chest x-ray. And if it goes that the client is having cardiomegaly, that's another phase of care management that you may have. Nakita niyo yung situation na even the client do not have yet confirmatory diagnostic test, pero it already flow in your mind yung analysis ninyo na yung pitting edema na yon is connected sa heart. Di ba? Dalawa lang naman kasi yung pwedeng concern natin pag nagkaroon ng pitting edema. Di ba? It's either problem with the heart or problem with kidneys. Yan naman talaga ang pwede natin i-consider. Kaya the next thing to do is, for example, the client do not have cardiomegaly. O what's the next thing that you must do? The kidney na. The client must be checked for diagnostic examination of the kidney. So, yung perspective of analysis why you need to consider pathophysiology, it's because hindi lahat ng pathway ng diseases ay pareho from one client to another client. Because for every client, they have their risk factors or they have different causes of why they do have a certain diagnosis. For example lang ha, you have 3 clients who may have all cardiomegaly. Pero not all is caused by inflammation of the what? Inflammation of the tricuspid valve. The others may be having a problem of the interior vena cava. Doon nag-cause ng damage. That's why it caused the particular backflow. So posible naman that the problem is sa ventricle. So yung isa namang third client natin, the problem is the ventricle. There is inflammation in the ventricle. So there's a possibility that the blood is not ejected. Then it goes the backflow. So yun yung certain analysis. Kaya that's why when you do case study, it's always scenario based. Although I do understand in your case study, you are given only very limited information. So magde-depend ka lang talaga dun sa information. But once you do, you have your participation in attending specific client, now all of the assessment findings, all of the patient history will now be your reference on how to make the pathophysiology and connect it with each other and using the knowledge, the basic knowledge of anatomy and physiology. Any questions? You want more? Want more? Okay. Let's have for example, the client is having diabetes. Ayan ha. What is the problem? What is the problem with diabetes? What is the problem with diabetes? Yes, Miss Fuentebella.
Mataas po ang sugar level po ni patient.
Okay. So if mataas ang blood sugar ni patient, let's proceed to let's proceed to the deeper understanding of that problem with blood sugar. Dalawa yung concern natin diyan, blood and sugar level, 'di ba? The blood and the sugar level. Now, what part of the body regulates breakdown of glucose? Mr. Gong. Nawala sa
Sir,
screen.
liver po.
Liver.
Ay.
What specific liver could be, but when it comes to the breakdown of glucose, what specific hormone?
Pancreas po.
Hormone.
Insulin po.
Insulin. Okay, next. What organ regulates insulin? Mr.
Pancreas.
Esquilio.
Pancreas po din.
Pancreas, correct. So, we are now connecting. Now, if the client has diabetes, there is something wrong with the pancreas. And what is in the pancreas that regulates the insulin? What is in the pancreas that regulates the insulin? What is it a gland? Is it part of the pancreas that secretes? Actually, insulin is a hormone. So what part of the what part of the heart? What part of the heart? I'm sorry. What part of the pancreas regulates insulin? Ayan, review tayo ng anatomy and physiology. Very important.
Glucagon.
So,
Enzymes.
ha? Sige.
Enzyme.
I want to hear answers.
Beta cells.
Beta cells, okay. You're almost close.
Islet cells din.
You're getting there. You're getting there. The answer is
Islets of Langerhans.
yes. Okay, very good. The islets of Langerhans or Langerhans, I can pronounce it correctly. The islets of Langerhans is the one responsible for secreting insulin, and the insulin is responsible for the breakdown of glucose. Now, if the client has diabetes, what is lacking? Because there is increased blood sugar. What is lacking?
Insulin.
Yes, insulin. So what will be the role of the nurse? The role of the nurse now is to check the function of the pancreas, and at the same time, the lack of insulin, the effect of it is it will not break down the glucose and may cause the possibility of increased blood sugar. Okay, let's gear towards this equation. Once it will increase the blood sugar level, what happens to the blood? If there is an increased sugar level in the blood, what happens to the blood?
Lumalapot.
Yes, Miss Delarmente.
Viscous po yung ano niya po.
Very good. So viscous. If it will cause the viscosity or increased viscosity of the blood, where is the blood located?
Inside the veins.
Inside the blood vessels, correct. If there is a problem with increased viscosity of the blood, and it is located inside the blood vessel, would you think that the increased viscosity of the blood may cause pressure to the blood vessel?
Yes po.
Yes po. Mabubuo.
Okay.
Yes,
So,
sir.
if will cause a pressure to the blood vessel, will it be possible that it will overstretch the blood vessels?
Yes po.
Yes.
Okay. If it will overstretch the blood vessel, do you think it will create pressure to the blood vessel?
Yes po.
If it will create pressure to the blood vessel, do you think it will create tension to the blood vessel?
Yes.
Yes po.
If it will create tension to the blood vessel, is it possible that the overstretching of the blood vessel may lead to inflammation?
Yes.
If it will cause inflammation to the blood vessel, do you think it may affect flow of circulation?
Yes
Yes.
po.
Yes, sir.
Now, if it will affect the flow of circulation, then what will be the effect? It will delay the circulation, yes or no?
Yes.
Delay po.
If it will delay the circulation, do you think it will also lead to delay distribution of oxygen?
Yes po.
Yes po, sir.
If it will delay the release and distribution of oxygen, do you think the cells will be deprived from oxygen?
Yes.
Po.
Yes po.
Okay, if it will delay the oxygen to the cells, do you think that it will delay or it will decrease also cellular activity?
Yes.
Yes po.
If the client who have diabetes have a wound, do you think it will cause a delay in the healing of the wound?
Yes.
Yes po, sir.
And what is the cause of the delay healing of the wound?
Hyperglycemia, sir.
Decreased blood flow po.
Nagsimula tayo sa hyperglycemia pero nag-end tayo, di ba, sa decreased oxygen in the cell. Di ba? So kung nag-decrease oxygen tayo sa cell, do you think yung delay and decreased oxygen in the cell delays also tissue repair and healing?
Yes.
Yes po, necessary po yung oxygen sa wound healing.
Correct. That's now the answer why a diabetic patient delays healing of the wound. So nakuha ninyo? Nakuha ninyo yung perspective na nagsimula tayo, we have started with increased blood sugar. We trace the problem with the blood sugar level. What's the effect in the blood? Where the blood is located, it has the effect in the blood vessels, and the effect of the blood vessels into tissues, and the effect of the tissues in the repair of dead tissues or damaged tissues. So kinonect ko lang siya on the perspective na bakit ang healing, ang wound ay nagtitrigger of delayed healing for diabetic client. Will it be also possible na ang most po ng mga diabetic patients affected ang vision?
Yes po.
Will it contribute ba yon sa hyperviscosity of the blood? Kasi
Yes,
we have micro blood vessels lang sa mata.
Yung nagkakatarata, sir.
Not possible, not maybe directly to the cataract per se, but probably most of diabetic clients pwedeng mabulag.
Yes
Pwedeng
po.
magbulag or
Kilala po.
possibly pwedeng mag-cause ng bleeding. Bakit? Because, di ba, because of the microvessels, pwedeng agad mag-rupture siya because of the hyperviscosity of the blood. So that's one. Another, di ba ang most of diabetic clients usually nagli-lead sa kidney failure, sa kidney problem. Am I right? Ang diabetes, high risk for kidney problem. Why? Kasi it's also the same na nadidecrease ang oxygen supply towards the needed oxygen toward the kidneys to function. So that's why the kidney could be affected when it comes to its own perfusion, and it may fail sooner because of that problem with the blood sugar level. Kaya that's why, di ba, very immediate po yan. Pag mataas ang blood sugar level, oops, bigay agad ng insulin kasi very crucial that it may cause multiple organ dysfunction. So that's the thing that I am emphasizing to you, na kaya nyong i-connect ang isang bagay into things. O sige, i-connect pa natin. Sir, pwede bang mag-lead to death? O papuntahin natin sa death ha. Yung diabetes ba na client ay pwedeng mag-lead sa death? The question is how? How? O pasok tayo sa ano, for example, sa hyperviscosity of the blood. O balik tayo with the hyperviscosity of the blood, it causes a delay in the blood flow. If it causes the delay in the blood flow, it decrease oxygen. If it causes decrease oxygen, papasok tayo sa heart. If decrease ang oxygen sa heart, pwede ba mag-compromise ang oxygen supply mismo sa heart circulation? Okay? What is the muscle that is very distinct sa heart? What is the muscle that is very distinct sa heart that that continuously cause its contraction? Go back to your
Myocardium po.
Very good.
Myocardium po.
Myocardium. Very good. Myocardium. So, since there is a decrease in oxygen supply, do you think the cells of the myocardial cells will also experience hypoxia or decreased oxygen? Will that be possible also? Okay. If the cells will be deprived from oxygen, will it be possible that there will be decreased cellular activity?
Yes po.
Yes po.
Pag nag-decrease ba ang cellular activity, hindi siya is it possible for the cell that will not respond for the heart to contract?
Yes po.
Yes, sir.
Yes. Okay, so kung hindi mag-contract si heart, hindi siya mag-eject ng blood.
Yes po.
Opo.
Pag hindi nag-eject siya ng blood, magdi-decrease ang cardiac output.
Opo.
Opo. Pag nag-decrease siya ng cardiac output, posible ba mag-decrease ang blood supply going to the brain?
Opo.
Yes po.
Yes po.
Pag nag-decrease ang blood supply
Sir.
going to the brain, magdi-decrease ba ang oxygen?
Yes
So,
po.
Yes po.
so pwede bang maka-affect sa consciousness ng pasyente na Center for Reticular Activating System yung condition ng pasyente sa consciousness?
Ay, opo, sir. Coma yan, sir. Coma.
Matik na yun, sir.
Now,
Matik po. Matik po.
if the patient will be deprived from oxygen, the possibility that if the cells will be deprived, pwede bang mag-cause ng tissue death?
Yes
Yes.
po.
Yes po.
Pag nag-tissue death yan, possibly, if the consciousness of the patient, pwede bang mag-comatose?
Yes po.
Nadali niyo, sir. Tama, sir.
Pag nag-cause ng comatose yan and continuously will deprive, pwede bang mag-extend yung tissue death sa brain tissues?
Yes po.
Pag
Opo, sir.
nag-extend yung tissue death sa brain tissues, then that will cause multiple organ dysfunction because the brain itself is the one that controls almost major organs of the body. And if that will be deviated, will it be possible that the client will have a problem with respiration?
Yes po.
Is it possible that the heart will not anymore eject blood?
Yes po.
Yes po.
Yes
Will
po.
it possibly
sir.
possible that the kidney will not anymore regulate blood pressure?
Yes po.
Will
Yes,
it be
sir.
possible that all vital signs will deteriorate?
Yes
po.
And
Yes,
that's the
sir.
chance that the client will have cardiac arrest,
Yes po.
and that may lead to death. So those situations, wala na nagsalita. And those situations
Yes po.
are on the perspective, okay, pag tinanong kayo, do diabetes be high risk to chances of fatality? Na-connect natin, di ba? We have connected with the function of the heart. We have connected with the function of the brain. We have connected with the function of the kidneys because these are major organs that is very vital when it comes to functioning of the body. Moreover, with the brain. So I think we have a question from the chat box. Din ask lang po, bakit po yung Coke? Bakit po yung Coke is good for diabetes? Okay, ganito po 'yon. Wala pa akong nabasang literature that Coke is good for diabetes. However, for diabetic patients, because example do you think too much insulin that the patient may have may cause naman sudden drop of blood sugar?
Yes po.
Yan. If that will be the problem, for example, yung too much insulin was administered to that patient, the problem now is very sudden naman yung pagbagsak ng blood pressure. And one of which to make the blood sugar increase, have the Coke. Because Coke itself has high level of calories and sugar. Lalo na for example, di ba yung mga nahihilo because of gutom. It's either, oh ma'am, baka sakitan siya ng tiyan. Kasi usually for those who may have, who skip meals, are already experiencing hypoglycemia naman. Ma'am, baka magka-ulcer siya. Ang concern natin ngayon is itaas ang blood sugar niya so that yung metabolic response ng body niya will regulate. And secondary na for the stomach to consider, kasi hindi pa rin yan magiging problem with ulcer kasi the cells of the stomach will regulate the control by hydrochloric acid. So that's it. So I think I hope you have answered the question in the chat box related sa Coke. Okay, sa Coke or any cola. Yan. So I think I have violated my schedule. It's already 6:45. So in this situation, we are already considering the pathophysiology, and at the same time we are connecting doon sa concept na plus ang age ba matters when it comes to response sa disease. Ang age ba nagma-matter? Will that be a major consideration, ang age?
Yes po.
Probably to what extent? Is it because ang response ng child, ng infant is different from an elder?
Yes po, kasi nagde-develop
Yes po.
pag-bata.
Okay. Let's have this perspective. An example. O sige, pasok na natin yung COVID-19. Okay, now, why is it during the time of the start of the pandemic, they concluded already that most of the elders are nasa A1. Nilagay agad sa A1 eh. Bakit naman hindi nilagay si infant sa A1? Bakit hindi nilagay si toddler sa A1? Why is it that the elders are the ones being prioritized in A1 compared to children? I want to hear answers.
Mahina na po
Mahina
kasi
na
yung
po yung
function ng katawan nila.
So I think Paulo is addressing his answer. Yes, Paulo?
So, dahil po pag mas matanda, mas humihina na po yung pang-function ng parts ng katawan or yung organs po ng katawan.
Okay. Now, general yung answer mo. Humihina yung katawan, weak na yung response ng katawan. Pero to satisfy your answer, why is it na humihina yung katawan? Why is it na mabagal yung response ng katawan? So that is basically the answer. Kasi for example, pag tinanong ka, why is it that yung mga elders natin ay dapat i-isolate kasi high risk daw sila sa COVID-19? Kasi sila po yung mahina ang katawan, sila po yung mahina. Parang nasaktan naman ako doon kasi matanda na ako, for example mahina ang katawan ko, but I want to be satisfied. I want to be satisfied more. Why humihina ang katawan ko on that level? Is it expected on my age? Is it expected for elders? So I think someone raised her hand. Yes, Miss Jaila Alangkas.
mahina na po kasi ang kanilang immune system po.
Okay. Let's dig more. Why is it that their immune system is weak compared to children? Ayan, compared to children. So why is it? We dig more. Yes, Mr. Harold.
Inversely proportional po din yung cytokines level po ng elderly and ng children po. Pag po mas
Okay.
mababa yung cytokines level po, mas compromise po yung kanyang inner protection po.
Okay. So you're getting more detail, tama. What is the function of the cytokines? Doon tayo pupunta. Kasi pagka ang child din naman has cytokines. And for the elders, what's the relationship of the cytokines? I think Mr. Delarmente.
Yung function po kasi ng cytokines po sa atin is, it is the one who controls po our immune system.
Okay. So controls the immune system. Now, the cytokines, do we have a different level of cytokines for elders and for children?
Yes po. Mas increase po ata habang tumatanda.
Nag-i-increase or nagdi-decrease?
decrease po habang tumataas po yung age ng isang
Decreasing. Okay, now. Now, we're getting there. The cytokines are responsible for immune system, and as it in the increasing age, it decreases the level of cytokines. So the cytokines are the ones that are very significant for the protection, okay, during inflammatory process. Now, we will now connect these cytokines that you have mentioned on how an elder is high risk for COVID-19 and how the children are considered low risk for COVID-19. Now, we referred to high and low level of cytokines. Let's start with what is the causative agent of COVID-19 infection?
Coronavirus.
What specific virus?
Coronavirus.
Corona. So that is the SARS-CoV, di ba? Yung SARS-CoV-2 virus. The SARS-CoV-2 virus will enter where? Saan mag-enter ang SARS-CoV-2? If you are exposed to a droplet, where it will enter? Di ba nasal? Okay. Will enter the nasal cavity. After the nasal cavity, it goes with the pharynx. Then proceed to larynx. Proceed to trachea. Pero most of this virus are usually take place in the upper respiratory tract. Now, do you think in the upper respiratory tract where the virus is present, will it start ba yung virus to damage tissues? Will it be possible ba that the virus in the upper respiratory tract may start the damage of tissues? Yes or no?
Yes po. Kasi po,
Yes.
kasama siya sa circulatory system.
Okay. So before mag-proceed siya sa circulatory, since nasa upper respiratory tract siya, nagkukos siya ng damage to the what you call this, sa tissues of the upper respiratory tract. Pag nag-cause ng damage sa upper respiratory tract sa tissues, pwede ba siyang mag-cause ng inflammation? Pwede bang mag-lead yan ng inflammation?
Yes,
Pag
sir.
na-damage, okay. Pag nag-lead yan sa inflammation, di ba, yung cytokines, i-release yung cytokines na yan as defense or protection, pero nagsisynthesize siya ng prostaglandin. Ang problem natin, si cytokines, pag nag-release siya at sinisynthesize siya si prostaglandin, that's the time na pwedeng nagkukos ng concern with temperature. Kaya nagpi-fever agad. Ngayon, on that note, dahil nag-start na siyang mag-damage to the tissues, will it be possible that the virus will travel going to the lower respiratory tract? Okay? So if the virus will travel to the lower respiratory tract, the lower respiratory tract tissues, including the bronchioles and the lung tissues, will be affected. Now, do we have glands? Do we have glands in the lungs? Do we have lungs in the lungs? Yes or no?
Yes po.
Thymus po.
Glands. Do we have glands in the lungs?
Lymph nodes po.
Yeah. So actually, we have the glands in the lungs that significantly produce the substance to protect from any injury and damage. Now, if for example, the cytokines is the one that protects the patient and it is increased because of the protection from further inflammation, do you think from the perspective of an elder who is decreased in cytokines will cause an extensive damage to lung tissues compared to a child? The answer is yes. If it will cause damage to tissues of the lower respiratory tract and the glands will be inflamed, will it be possible that these glands will produce, the mucous glands will produce more secretions than usual?
Yes.
Yes po, sir.
Do you think the secretions, because of inflammation of these mucous glands, do you think these mucous secretions may cause obstruction of the airway passages?
Yes,
Yes, sir.
po.
Yes po.
Do you think these secretions may lead to a possible infection?
Yes
Yes, po.
Do you think the possibility that that elder will be high risk for pneumonia?
Yes, sir.
Yes
Yes.
po.
Then that answers why the elders are high risk, because they are high risk of developing pneumonia. And pneumonia is fatal, because once pneumonia develop to the client who is an elder and cytokines are decreased in its level, it will cause extensive inflammation to airway passages. The client will experience difficulty of breathing. The client will be deprived from inhalation of oxygen, sudden drop of oxygen saturation. The patient will experience respiratory arrest and definitely, possibly, death. So can you now connect? You will be more confident now pag sinagot nyo yan sa, for example, sa kumakain kayo ng dinner o dinner time. Handa na ang Lucky Me noodles. The dinner time. Anak, bakit ba parating yung matatanda ay nadidiscriminate? That they are always high risk for COVID-19. Ito pa lang ay wala pang vaccination. Ma, kasi when the SARS-CoV-2, ayan, pupunta ka na dyan. Kasi if the SARS-CoV-2 enters the nasal cavity and reaches the upper respiratory tract, the level of cytokines for elders are low compared to children. And thus, the problem is that of the virus is capable of damaging tissues. If it will cause an early damage to tissues, it may lead to a possible inflammatory process. And the cytokines will be released to protect the inflammatory process. But the elders have low level of cytokines. That's why the SARS-CoV-2 will proceed to the lower respiratory tract, because the cytokines are not sufficient to protect its inflammatory process. As the virus travels to the lower respiratory tract, the lungs and the glands are now affected. The damage starts with the glands and lung tissues. And here comes the problem, The mucous glands will be enlarged due to inflammation, and it will produce more mucous secretions. And these mucous secretions will increase its production and will cause the obstruction of airway passages. And if it will cause the passageway as obstructed because of the mucous secretions, the client will be experiencing severe difficulty of breathing, Then those mucous secretions could be high risk for possible what? For possible infection, because the cytokines are also very significant in infection control. And thus, if the patient will develop pneumonia, who is an elder, it will extend its damage to other parts of the lungs, and that elder will cause a possibility of problem with oxygen saturation, and continuously the infection will spread on continuously damaging the lung tissues, and eventually may lead to respiratory arrest, and that may lead to death. Ang haba ng explanation. So nakikita ninyo yung perspective na sinabi natin na kasi mahina na yung immune system niya. Kasi matanda na siya. O di ba? Ganun matanda na siya, hindi na siya mag-respond sa immune system. Pero this is the way I am seeing you explaining to your mom na very comprehensive yung knowledge ninyo on why the elders are high risk for infection. Okay? Since I have violated the time frame, supposedly 6:30, so probably we could have the 15 minutes health break, and we will continue from 7:15 to 7:30 as scheduled for the synchronous. So let's have a break. We are just on the first slide of our discussion. Okay. So have yourself hydrated and keep your level of energy its height. Okay, be back after 15 minutes. Okay, let us continue. Hoping everyone are here already. So to continue with our discussion, as we discussed that in when it comes to the disease process, this the age, the population group, the age and the population group are very significant to the response to every diseases. That's why it's very important for all of us to significantly identify the risk factors. And the pathophysiology will definitely orient you as a course on the understanding of why etiology, manifestation, symptoms, and signs are very important to consider in the development of a disease. I just want to ask, because you have already completed your fundamentals of nursing and you have already completed and presented rather case studies. What's the basic difference between signs to symptoms? What's the difference between signs to symptoms? Anyone in the group?
Dean,
Yes,
ano
Mr.
answer po?
Esquilio.
Yung sa signs po, yung nakikita po natin ng mga nurses and doctors po. Pero yung symptoms naman po yung napipili ni patient.
Okay, that's correct. Thank you very much, Mr. Esquilio. When we talk about signs, these are results from the nurses, physical examination findings, vital signs, and from the results of diagnostic examination. While the symptoms are basically considered and verbalized by the client. So this is validated, or these are validated through the what we call signs. So giving us the direction of the validation and confirmatory test, the signs and symptoms are very important for us to give a direction on how we will have our pathophysiology. Because usually, vital signs confirmatory tests are references that will validate the body's functioning. Just like if your symptom or if your vital signs is hypertension, then you will relate it to your patient history if the client has history of hypertension, because we all know that hypertension is a familial. Okay, it's definitely familial. Now, hypertension, when the client verbalizes symptoms of the lightheadedness, so it's basically may not direct to a problem with hypertension until it will be validated by the signs of confirmatory through vital signs of checking the blood pressure. So on that note, you are given already the idea that the problem is with the heart. So the tests that will pursue for the nurse to consider are tests related to the heart, so that to connect and so that to consider what could be the possible and confirmatory diagnosis that the doctor may decide for treatment regimen. Now, with the other course outcomes, we have to distinguish the environmental factors, physical, psychosocial, cognitive, and various diseases and conditions. Distinguishing these factors are considered as already risk factors. Now, I know for a fact that you have already presented pathophysiology before, but what is the difference between modifiable to non-modifiable risk factors? Anyone? What's the difference between modifiable to non-modifiable risk factors? Yes, Miss Kyla.
From the word itself, pudin, which is modify, so which means that non-modifiable is we cannot change. Like for example, po their age, their
Okay,
gender, and then
correct.
for the modifiable factor on the other side po is we can through our nursing intervention management we can be able to change po.
Okay. So with that explanation, it's clearly stated by Miss Delarmente, and it is definitely correct. So she had an example of considering non-modifiable risk factors for age. and gender. When you are about to construct or to make an algorithm of pathophysiology, then you must take into consideration that for age, why the person is high risk because of age. Why the person is high risk most for gender, male rather than female. Just like, for example, as based from the literature, most of the males are high risk for hypertension. Can anyone elaborate why? Can anyone elaborate why males are high risk rather than female for hypertension? You can raise your hand. How about for the others? Why do you think why do you think that males are basically high risk for hypertension? Yes, Nathan. Yes, Mr. De Leon.
Napindot po.
Ay, napindot. How about for the others? Okay, let's have a brief explanation on that. Physiologically, males are high risk for hypertension rather than, okay, I think Mr. Gong may have an answer. Yes, Christian.
Ano lang po sir, thought lang po, di po,
Yeah.
di po sure.
Sure.
Siguro po sir, kaya po mas high risk po yung male sa ganun sakit po kasi po mas marami po silang bisyo sir. Like alcohol. Kaya, yun po sir. Yun lang po.
Okay. Because probably you base it with the factors that based from the literatures, males are more engaged into problem with lifestyle. Yon. So because that's one. But considering the lifestyle, that is considered as non-modifiable risk factors. However, your explanation could be right also, because most of the males, based from evidences, males are high risk for hypertension because of lifestyle management. And if ever the patients are identified with the problem with lifestyle management, what specific in the lifestyle management do males are high risk? Example, smoking and alcohol drinking. So the smoking and alcohol drinking will be now identified as non-modifiable risk factors because the smoking and alcohol drinking is by choice of the person, right? Choice of the person. So if the person becomes more alcoholic and engaged into smoking, he's the one high risk for non-modifiable. So the basis natin for male as high risk, it's because of the literature and findings from the evidences of the lifestyle problem. There could be also other answer to that. Eto po. Do you know that males are the first one on the age of 40s and 50s will cause the thickening of the bulbs rather than female? Because the female may experience the thickening of the bulbs because this is expected for elders or increasing age. It so happened that the male is the first one that may cause the thickening of the bulbs compared to females, because the females may have the thickening of the bulbs at the time that they reach menopausal age. So with the age itself of the male, that is based from the literature of 40 to 50 years old, and based from the scientific explanation that the thickening of the bulbs primarily starts at the early age of male compared to female, that's why males are high risk more on hypertension. Di ba it gives us more clear explanation? On that note, okay, that's a more scientific that is more scientific explanation to that. So that's why For all males there, students, if you have already engaged yourselves earlier in the smoking and alcohol drinking, and at the early age that we are aware, scientific explanation says that the thickening of the bulbs will happen, the early age also that you will have hypertension. Now, why is it that for female may have the delay thickening of the bulbs compared to males? It's because of the hormonal level. The hormonal level is very significant for the functions of the cell. Once the female individuals experiences menopause, hormones are also decreased. Hormones are very necessary for metabolism and response of the cell. That's why there could be possibility that the chances of preventing the inflammation of the bulbs may be considered because hormones are already decreased and inflammatory process are not anymore controlled for females. So that will give us, yan yung gusto kong ma-discover nyo, na pagka you have your books, you have your e-books, why is it that male are high risk for hypertension than female. Males are high risk rather than female. I want to hear from you when you explain that in your case presentation, that comprehensive, because it has always a scientific explanation. So you dig on that explanation. So I may be wrong in some ways. There could be updated scientific explanation. That could be more. Kasi lalo na ngayon, so if we will try to consider yung lifestyle ng male at saka female who could be high risk for hypertension, almost pumapantay na, almost the same level na, hindi na nagkakalayo from the research findings ang smoking at alcohol drinking when it comes to lifestyle ng male at saka female. And to give you an update, females are now more engaged to smoking and alcohol drinking rather than male. So that's one that can be considered as modifiable risk factors. The latest findings that you may have on literatures, the chances that that could be considered as your source for considering high risk individuals for age, for the gender, and lifestyle modification. So I have only last 3 minutes. Number 2, identify implications of therapeutic interventions for diseases and conditions. Now, as what I have told you, there is a connection, there is a relationship on how you will have clear directions and appropriate interventions for your care management for the client. What is that? What we call implication. Okay, the implication that I'm talking to is, for example, you have mentioned that the confirmatory test is very important so that it will give you a clear direction on appropriate intervention. That is basically correct. Now, let's have a typical example of complete blood count. So for the complete blood count, what are the components of the complete blood count test? CBC. I know you have undergone medical exam, medical clearance, and you have undergone CBC. What are the basic components of the CBC?
White blood cells.
Okay. Any
Hemoglobin
others?
count.
Hemoglobin count. Any other?
Hematocrit.
Red blood cells.
Hematocrit, red blood cells, platelet, di ba? Those are the common components of CBC. Now, if for example, if I will ask you, if there is normal references for diagnostic examinations are very important. That's why even in your case studies, you are giving rationalization if it is normal and deviation. And out of deviation, you will connect it to pathophysiology. Now, if the client will have below normal range of RBC level, what could be the interpretation? Low level of RBC. 5, 4, 3.
Anemia po.
Anemia. Ayan. So hindi pa tayo umabot sa explosion. Anemia. Okay, anemia, that's correct. Now, how about the medical condition that the client may have if we have elevated RBC? Polycythemia. Ayan.
Polycythemia.
Polycythemia. Now, when it comes to hemoglobin, for anemia, hemoglobin is characterized and our basis for the oxygen level, the capacity of carrying the oxygen through the red blood cells. What do we expect for anemic or for with anemia? Decrease hemoglobin or increase hemoglobin?
Decrease.
Decrease hemoglobin. That's correct. How about for hematocrit? The hematocrit will give us the information when it comes to viscosity. When it comes to the viscosity of the blood for anemia, do we have hypoviscosity or hyperviscosity?
Hypo.
Hypoviscosity, correct. On the other hand, if we will try to relate our responses to the increased RBC, which is polycythemia, so obviously we have increased hemoglobin and increased hematocrit as the opposite result. Now, which of the two conditions, anemia, polycythemia, may need blood transfusion?
Anemia po.
Anemia. What is now our rationalization and analysis? Why do they need the what we call blood transfusion? Diba we have mentioned decreased RBC, anemia, that's decreased red blood cell in the blood. We have mentioned that the hemoglobin level is decreased and the viscosity is decreased. Now, I would like to ask you, for anemia, do we have increased volume of blood or decreased volume of blood?
Decrease.
Chris, okay, Chris. The answer is decreased volume of blood. So we have hypovolemia. What is hypovolemia? Hypo, decrease, volume, emia, hypovolemia. Now, for the polycythemia, chances that the client may have hypervolemia. Go back to the question. Which of the two conditions may possibly engage into blood transfusion procedure? Hypovolemia or hypervolemia?
Hypovolemia po.
Hypovolemia. Because the term itself of decreased volume of blood that signifies decreased RBC, decreased oxygen, and decreased volume itself may cause the possibility ba ng decreased cardiac output? May possibility ba ng ang anemic individual may have decreased cardiac output?
Yes, sir.
Yes po.
Yes, it's because it is justified with hypovolemia. That is the answer. Why the client is having blood transfusion because of decreased volume of blood. Hypovolemia. So those are the things that that possibly may be inculcated to you by this course, and eventually on the course outcomes, just like number 3, demonstrate a basic understanding of the concepts and elements of disease. The basic concepts and understanding and elements of the disease are very particular on how you will analyze disease process. Siyempre, you will start and gather information from the client that will conclude as your risk factors. Class ha, if you will make pathophysiology out of the case, don't copy the pathophysiology that is in the book. Why? Because not all risk factors that are identified in the book, kasi in the book, in our references, all of the risk factors could be identified. But if you will have case study, it must be the case-based. The case-based, meaning you will only consider risk factors based from your case, and that will conclude pathophysiology. That's what I have noticed when you make pathophysiology. Most of the time you include all of the risk factors, but it is not it is not present with your client. Regardless if in your case you only have 2 risk factors, then that's the only risk factors that you may consider, so that you may have an analysis why the client has this type of diagnosis. Number 4, demonstrate an understanding of mechanism of diseases, diagnosis, and treatment of diseases. As what I have told you, this is connected with each other. From the start that the client experiences the onset of signs and symptoms, from the time that the client will be high risk for complication and possibly death. So that's why for nurses who will be assigned in the critical care units, it's very crucial for all of you to check and prevent client from complication, or moreover, prevent death of the client. So you must take into consideration on the pathophysiological perspective on how the client may lead to death. So you need to monitor specific vital signs that will guide you on how the client will prevent these complications and may lead to death. Number 5 and number 6 are connected with each other because, class, I have oriented you with some of the drugs and mechanism of drug effects sa body natin. And moreover, pharmacological treatment of diseases or conditions are very important. Di ba, class, if you can remember in the pharmacology, I have taught you of the FDA risk category for pregnancy. Class, di ba, there are 2 aspects that you must take into consideration when giving a drug. The effect sa mother and effect to newborn. Even with the substance abuse, if you can still remember, if the mother took high level of alcohol of more than 1 to 2 ounces, the mother may experience a possible abortion, while the newborn could be high risk of fetal alcohol syndrome. So on that note, we can identify that why we need to emphasize to pregnant client to avoid alcohol, because significantly it may have a direct effect to the mother and at the same time to the child. Similar also of our knowledge when it comes to the drugs that you're administering that may risk also the client. So we have 6 discussed common laboratory, excuse me, common laboratory and diagnostic tests. Actually, when we talk about the physiology, so I have to 5 minutes more. When it comes to the physiology, the branch of which we are talking about is, we have talked about normal function, and that is physiology. We have already explained anatomies pertaining to the structure, and the processes are more on the physiology. When we talk about the function, when it talk about the response, that's why nga we have been oriented that in the Maslow's hierarchy of needs, what is your physiologic need? The physiologic need, water, air, food, because these are the things that will be essential for survival, and which the processes will be affected if it is not met by individual. That's why the physio is defined as nature and the ology is defined as the study. On the perspective of the physiology, it can be divided into the following. If we talk about the study of cell is cell physiology. Why do we need to take into consideration the normal function of the cells? Because remember, from the time of my explanation, it will always end up to the function of the cell if it will affect yung continuous deprivation of oxygen, which is hypoxia, and possibly may cause tissue death. And if you notice, if it reach already the cell problem, it will lead to another complications. Even for malignancy or cancer. It is very important po, class. Di ba you have been oriented in your anatomy and physiology that each cell has distinct characteristics, shape, size. There are cells that are distinct in the stomach, in the lungs, and so on and so forth. For the brain, it is identified yung endothelial cells, and it has distinct features and characteristics. If we're talking about epithelial cells, that could be identified in the lungs. But how about if the cells are identified microscopically that it doesn't look like epithelial cells for lungs? That is the time that the client will be subject for further tests if chances to confirm specifically cancer. Now, for special physiology, this is the study of the processes of specific organ. That's why if I mention to you liver, what are the functions of liver? Hoping everyone can answer. What's the function of liver?
Detoxify po.
Okay, detoxification. Any other? Di ba it regulates bilirubin or the cholesterol? Okay, next. What is the function of the gallbladder? The function of the gallbladder is basically the temporary storage and release of enzymes for cholesterol synthesis. Now, do the liver and gallbladder can be connected with each other? The answer is yes, because the liver and the gallbladder will be significant when it comes to the synthesis of cholesterol. So that's why when it comes to special physiology, it will give us the idea on how these organs will be connected with each other. Another, if the client experiences hypertension, obviously the client's heart is the problem. What organ will basically respond to help the heart stabilize blood pressure? What other major organ will help the heart? Kidneys. Very good. So that's why if we have a problem with kidneys, there are two organs that you need to monitor. It's monitoring the heart and monitoring definitely the kidneys. If you don't have a problem with the heart, then proceed to the next evaluation of kidneys. When we talk about systemic physiology, so very obviously from the term it's subsystem, just like for example, the client has a problem with urination, difficulty of urination. So what could be the diagnostic test that the client may have?
High blood.
What diagnostic? We are referring to laboratory. The client is having difficulty of urination. What diagnostic test that the client may have? So, syempre, you will associate with urination. Yon.
Urinary
Urinalysis.
retention.
Very good. Urine analysis. So, if the diagnostic test is urine analysis, then if there are no findings with urine analysis, okay, there's something wrong with the organs that is connected with the urinary system. So, it could be bladder, it could be parts of the ureter, and definitely it could be kidneys. Now, if we talk about the systemic physiology, and we still don't have the confirmatory diagnosis, then the systemic physiology will give you an answer of the possible affecting system on the organs. Kaya that's why the client, if there are no findings with the urinalysis, the client will be subject for ultrasound. KUB. So ano yung KUB? Kidney, ureter, bladder. Because that may be one of the tests that may significantly give an evaluation on the system. Now, what is pathological physiology? If we say pathological physiology, from the term itself, patho, diseases, physiology, process. So this is now the study wherein the effect of diseases mainly affects the normal processes of the body. That's why yung pathological physiology, pag pinagsama ninyo, pathophysiology. When it comes to pathophysiology, we are studying the processes and at the same time, the effect of the disease in the normal functioning. So since I have already extended, I know that probably in the next meeting, we will take up this. I know this has been oriented to you and discussed in your anatomy and physiology, but somehow I will need to review the 6 structural and functional organization of the body because it is very important for us to consider in the pathophysiology. So I think I may end up my discussion because it's already a synchronous session. However, I will give you the instruction where when you will do the access in the Neo LMS of your asynchronous task on a later date for submission. So probably I may stop the